To the doctors of Reddit, what is it like when you have a doctor's appointment? I avoid disclosing I'm a doctor unless specifically asked what I do for work. I think I'm better taken care of when the doc team is most comfortable and working in their routine. Difficult and demanding patients who request special treatment often have worse outcomes. I don't want to be one of them. I completely agree. I never tell them I am a doctor. Same thing when I take my kids to a pediatrician. I just want to be treated like a regular patient. Only exception was when I broke my hand and needed it operated on ASAP, not 10 days later. Went to student health as a med student. Attending I worked with the week before does my PAP. With a resident, he asked. I said yes. Kept quizzing me, what am I looking for? What does it mean if the PAP is positive? Etc. I am getting questions right, but he's being real weird about it. Realize in parking lot after apt he was asking the resident, not me. Rotate with said resident a few months later. Freaking fantastic. With my mom, it was like this. Mom, I think I have basal cell carcinoma on my back, but I can't see it quite clearly. Damn, you do have basal cell carcinoma. Good job. My mom drove herself to the ER and said, pretty sure I have appendicitis. She's a doctor, but to be fair, it's got some obvious signs, and they doubted her because she didn't look like she was in enough pain. Turns out it was about to rupture. Being a resident, I always wonder which one of my co-residents is working in the emergency department as I drive home from a shift, knowing if something were to happen, they would be checking my rectal tone in front of all my co-workers. And then I think about how big their hands are. Male gynecologist here. When I have a patient come in for a PAP, it is always a bit annoying when they leave their underwear on under the gown. I have to step out of the room and wait for them to remove it. When I went in for my first physical in years, I stripped naked under the paper gown. Apparently guys don't do this. They leave their underwear on. Who knew? My family doc, who is also my best friend, had a good laugh at my expense over this breach in etiquette. He also texted me the night before to let me know he was putting the KY in the fridge for my exam. I'm always a little annoyed when I get to an appointment and I'm not explicitly told which layers they expect me to undress to. Not everyone knows. It truly depends on the way you act. Most of the time I won't tell the doctor that I'm also a doctor unless specifically asked about it, or if there is a slip of my tongue about symptoms or any other medical words. Some doctors tend to be not too specific when they know you are a doctor because you already know what's happening. Sometimes even my wife gets the ask your husband to clarify your questions. I try to have an open mind when I'm the patient because we are trained to think the worst, so there is a lot of cancer in my mind. Currently I work in a palliative care unit. I have had medical patients and carers, and I would say that it is truly diverse how they react. We are also human and we are sick and vulnerable. The doctor vein can go completely off or go on overdrive. Turning it off is better and less intrusive most of the time. There is a lot of cancer in my mind. You should probably have that checked out by a doctor. I hear cancer is bad for you. Whenever my dad, who is a doctor, took me in for an appointment when I was a kid, it was always super awkward because if anything was done even remotely incorrectly, he'd basically do the medical equivalent of the let me speak to your manager routine, which I kind of understand in that context, since it's your kid's health you're talking about and not a freaking expired coupon, but still, made me want to melt through the floor. 99. In my experience, doctors tend to be pretty decent patients when admitted to the hospital. They know the routine. They get to know the nurses. They try not to hassle anyone. They can speak to their own doctors as colleagues, etc. Nurses, on the other hand, feel it is very important for you to know, at all times and in every sentence, that they are nurses and they are much better at nursing than you. I will say there was this one instance of a doctor patient and a hospitalist getting into an argument that was pretty interesting. Basically, doctor patient disagreed with what the hospitalist was doing and asked if hospitalist had read any of the recent studies which suggested that he, instead, follow a different protocol. Hospitalist was not down with the let's talk as colleagues and decided to go full on frick you. I'm the only one wearing pants in the room right now. There was a mild argument but it remained incredibly civil. 2 days later the hospitalist was fired. Doctor patient's brother, or some other close relation, was the CEO. Nurses tend to thrash. Doctors go for surgically precise cuts. I mean, It makes me wonder how often he was actually listening to his patients. If he wouldn't listen to a fellow doctor, your average person doesn't have the knowledge to advocate for themselves, and this guy shut down a medical professional who was doing just that. Med student. Had to go to the ED and then surgery for appendicitis. Got pimped by the surgeon. Felt bad man. Not a doctor, but as the husband of a nurse, it's horrid. My wife and the doctor nurse practitioner will sit and bat ideas back and forth until they can get my wife to accept the diagnosis as her own idea. Nurses are the worst patients. I had to actively tell myself to shut up multiple times when I broke a bone last year and just politely accept or deny the care they offered, because I didn't want to become the stereotype. I'm a doctor. We make terrible patients because we tend to minimize or rationalize every warning sign. Going for a doctor's appointment basically reminds us that we can also get sick, and since we have a burden of knowledge, we're just hoping we don't find something that'll force a lifestyle change. Otherwise, most times it's been a pretty standard experience in terms of registering, waiting, and being seen for 15 minutes. If you go to someone you know personally, which I actually recommend against, you might get some preferential treatment, but it's mostly the same. Other way around. I'm a nurse and was taking care of a doctor I work with. She asked me if she should give a urine sample and she wasn't in for something I'd usually get one for, but then she made me nervous cause she should know that. So I was, "You're the doctor, you tell me," and she said, "Nope, you're the one calling the shots now," and I was like, okay, well, think we are good without one then. It was pretty awkward all around. But I work labor and delivery, so we deliver a lot of our own nurses and doctors, which is strange but also nice. My grandpa used to teach anatomy in med school and his students got my grandma when she was in labor. She says she got the best care ever because they were terrified of having their professor's wife. Today I learned that doctors go see other doctors. I thought they healed themselves naturally, like glowy mist thingies oozing out of their bodies and raising up into the air. But I have heard of barbers going to other barbers. If there is only 2 barbers in town, go to the one with the worst haircut. My PCP doesn't know I'm a physician. When he asked, I lied about my profession. Pretty great really. Front of the line type stuff. Call my PCP friends or partner and say, "Hey, what are you doing for lunch? I've got a thing on me I want your opinion on. I'll buy you lunch." Or a radiologist, "Hey man, my shoulder's been killing me. I lifted too much with it and now it's balked. Mind doing an MRI? Sure. What's lunch look like for you?" Basically I end up buying people lunches and they don't have to document anything. Win-win. My dad is a pharmacist, and the number of times I'd come out of an appointment with a certain prescription and he would call the doctor to tell them to change it is countless. Most of the time he was colleagues or had a 1 degree of separation kind of relationship with these doctors, so they didn't seem to mind even though it was awkward for me personally. Typically he knew of a better option or just wanted the generic, which would save him a bunch of money. I had one eye doctor who was P though, so that was not fun. Drugs can be expensive as frick, so I don't blame him. You have been visited by the bee of jazz. Like this video to have your ears filled with cool jazz. I hope you got your mind wrapped around these facts. What's your reaction, and do you also know an unsettling fact? Let us know in the comments. If you are new to the channel, you can subscribe. I upload new videos every day. Until then, check out another video if you like.